Rolf Lieback is swimming for his life. Daily exercise is helping him cope with multiple health problems.
Well, I ended up with diabetes probably about 10, 12 years ago, and I'm still on pills. And I also had heart problems, got a triple bypass.
Despite the health troubles, Rolf's enjoying his retirement. He likes sailing and traveling. He swims and walks daily. Like many people who suffer with chronic diseases, maintaining a regime of regular exercise, a healthy diet, and attentive medical care offer Rolf the best possible management of a difficult situation.
Well, at least keep it on a level, the same level, so it doesn't deteriorate.
But now Rolf has a new tool to help him manage his health. He was asked to experiment with the Personal Health File as a self-management device that's being used in Kitimat and surrounding communities. It's a small blue binder, much like a black box, of valuable information about the patient. Patients and medical personnel record any information that can help track the progress of the patient's health.
I keep track of the sugar diabetes. I take blood samples 2 or 3 times a day, and I record them. I have an apparatus to take my blood pressure. I do that usually daily. In the morning, I record that.
That's great. Blood pressure still looks good, Rolf.
Laurel DeGoy introduced the Personal Health File to the patients of Kitimat.
We're very surprised to see that they're empowered. They really like to take charge of their own health records.
The low-tech approach and the design of the ring binder has made the Personal Health File user-friendly. Credit goes to its graphic simplicity and clear organization, with tabs for quick reference. It's entirely free of anything that might confuse the user.
It's pretty much the same as my list, eh?
They are working more collaboratively with their family physician, not just the doctor, but also the office staff, to have consultation reports, lab work, and so on followed. They're tracking more of their health care parameters, like their medications. They know what the names of them are, the dosage, and why they're taking them.
Rolf finds the book very useful for keeping track of his medications, especially when he travels.
I'm taking right now 17 pills a day. If I would go to Vancouver and the doctor asked me what medication you take, I wouldn't know. I would have to have it written down. And that's where it is, in that health file.
Very often patients come in and I have to change medications, and then I have to ask them to come back with all their medications so I can show them which changes to make. Having the personal health folder, I'm able to make those changes in the personal health folder, and the patient can do that at home themselves with greater confidence.
This file is an excellent idea in the sense that it provides the patient with the opportunity to take care of themselves.
Yet another advantage of the Personal Health File is in emergency situations.
I'm very grateful when any patient comes with their personal health file. It's such a great starting point if the person does not speak English. Oftentimes in the emergency department, you may not even know the name of the person that comes in. And the personal health file allows me to access some of the most basic and most important information as to what their allergies are and what medications they're on.
Well, I found it very helpful. On occasion, I've had fainting spells, and I've had to go to the emergency. I take this with me, and it seems to be no problem.
In case of a medical emergency, medics can find a fridge magnet with directions for locating the binder.
The magnets are a good idea. I keep them on the fridge with both our names and where they kept.
Our seniors use it the most, and then from there I would have to say people with chronic disease, and then again people who've had probably more than 2 surgeries. I encourage it and try to promote it even outside of this office.
And the Personal Health File is now gaining acceptance in other communities in the Northern Health Authority.
I'm ecstatic because it's put Little Kitimat on the map, and it really has improved the health care of the residents with chronic disease.
I think I have a lot more control than I had before, yeah. At least I can talk with the doctor on the same level, on the same language.